Well, I want to welcome everyone. My name is Patty Sherman Campbell, and I'm the Director of Alumni Development and Strategic Partnerships for FMCA. And as you may know, the Functional Medicine Coaching Academy is an organization committed to creating a culture of wellness by training coaches to partner with clients and collaborate with practitioners. I want to welcome and introduce you to our founder and CEO, Dr. Sandra Scheinbaum.
Hello, everybody. It is such a pleasure to be with you all today and to introduce Dr. Roy Hall. We are privileged to have him, and we're going to talk about a very, very important subject, which is how can coaches serve the medical community now more than ever as we transition to a telehealth model. So I am just really excited to offer this today and to turn it over to Dr. Hall. Patty, did you have anything more to say before I launch?
Sure. Well, I guess before we get started, in the chat box, please let us know what you specifically would like to get out of the call today. And because we have a great group here, feel free to mention some of your biggest pain points in your practice. Maybe it's not related to virtual practice, because I think everyone can share some tips to help. But yes, welcome, Dr. Hall. Thank you.
Hey, it's good to be here. And yeah, it's been a slow day. I've been looking for this all day long. Somebody to talk to. I've had a conversation with one patient at 9 o'clock our time this morning, and my office person is out sick, and I'm afraid of what she has. So it's just going to be good, I think.
Well, good. Thank you. Well, maybe.
Anyway, June. Well, go ahead.
Oh, no, go ahead.
I'm just going to give a little history. June of last year was my 40th year in medicine, and I started as a medical oncologist for 32 years and just got totally burned out, and have been doing functional medicine now 4 years and been working with a health coach really 3 years, and it's been heaven. It makes my life easier, and the folks are getting well faster and better when there's two of us working, so this has been a real godsend to me.
Wonderful. Thank you. Well, maybe if you could share with us why you wanted to transition to virtual only services. Was it only due to COVID?
Yeah, only due to COVID. I really don't like it. And in our functional medicine clinic, we do both functional medicine and then hormone replacement therapy with pellets and regenerative medicine injections into joints and whatnot. And for the functional medicine program, the last 4 years, I've been having weekly dinner seminars at restaurants where I'll present how we treat things differently and get the people interested in coming to the clinic for a consult, and then we get them into our functional medicine program. Now with this COVID thing and the restaurant shutting down, we're switching over to webinars weekly, and I have to say I haven't learned how to do it very good. My track record is not real good on closing or whatever. So yeah, I don't like this virtual thing. I'd rather have people in front of me in person, and I like them in the office better.
Right. Well, it's great that you were able to be flexible, though, and transition to something that's needed for right now. So I appreciate that. Can you tell us what your practice looked like before converting to a virtual practice and what it looks like now?
Yeah, with our wellness programs, and for 4 years, what I was doing was selling a program 6 months, 8 months, or 12 months. And basically, I'd get those people in to see me every 2 to 3 weeks during that 3 months, 6 month, whatever. And then working with Allison, our health coach, they work with her every 2 weeks for 3 months. And since last summer, we switched everything to 3-month visit or 3-month programs. One, it's a lot cheaper, and we're signing more people up. And what's happening after 3 months, really, we're finding, Alice and I, after about 3 months, either they're a whole lot better or they're not better and they're not doing what we tell them to do. And so we can separate at that time. And the ones who are better, then we have a program, we'll work with them up to a year with unlimited visits. So up into this telemedicine things, I had people coming in here every 2 to 3 weeks to see me for an hour visit. And then they'd be with Allison every 2 weeks for the first 3 months. And what's happening now is I get on with Zoom with them now every 2 to 3 weeks, and they're on Zoom or phone with Allison. So really hadn't changed much, I think, with Allison, but it's really changed our practice up where we don't see people, and it really gets kind of lonely here.
Mhm. Yeah, that is a component of it for sure. Well, I know you mentioned Allison, so maybe talk a little bit about how you collaborate with Allison, and then I'd be curious at the end to know if maybe you wonder about if having a virtual coach helped mitigate any resistance to virtual appointments with you that helped in the transition.
I've been working with a health coach now 3 years, and I had another coach I was working with from North Carolina that went through your training program, worked really good, and then she moved off to England, and she helped me find Allison, who's again in North Carolina. We're in Billings, Montana. And really, I've had no issues with people getting on the phone or the computer with Allison. I say, we're miles apart, but you're going to like her. And the nice thing is she's on the Eastern time zone, but she'll work with you in the afternoon or evening times. You don't have to get up at 5 a.m. to visit with her. And so, and I tell everybody that after working with a health coach for about 6 months, I got kind of pissed off. And they look at me like, why? And I said, well, I realized people were getting well faster and better when it's two of us rather than just me. And I said, it kind of made me mad because I'm the MD. But then what I go and tell them is, one kid can fool one parent a lot, but one kid can't fool two parents ever. And with Allison and I, we just have more accountability with you. And I forget to ask a question, she asks. If she forgets, I ask. And if we get stuck, we have two people pulling you out of the hole. And they really like that. And really working with Allison, it works that way. If I forget something, she does it. If she forgets, I do it. And because we're both IFM trained, we use the same tools, and we know how each other thinks and what the other person's going to say with these people. So did that answer your question?
Yeah, it sure did. Yeah,
excited
absolutely.
with Allison. Yeah.
Yeah. So maybe the transition, so your patients were already comfortable with using a virtual platform. So maybe it's just in terms of you were having a little bit of getting used to with the virtual platform.
Yeah, let's blame it on the doctor again. They were used to it, but I was not.
Okay.
I am hoping to master this webinar thing and maybe do a lot more virtual things even after we get past this crisis, because it is a lot easier, and it's because we live in a huge state and we have people all over the state, and this would be a lot easier than having them to drive down here every few weeks to see me. So I see a lot of advantages of what we're going through. I'm 66. I got to learn how to do this thing.
This is Sandy. If I could just interject that there is some research that shows that the effectiveness, and this was a world of coaching as well as psychotherapy, that it is actually just as effective. So even though you may be doubting because it is new, but I would bet that your patients are finding a good experience, and those seniors will learn, and then they will feel so excited when they can get to connect with Zoom.
But yeah, I think all of us seniors need to learn this thing here. And that is exciting because it really is easy to do the virtual visits. Yeah, because I could even do it at home. I'm still coming into the office every day to do our clinic stuff, but I could very easily do it at home if things get bad and I don't want to come in here. But again, we have a few patients every week that need to come in for either pellet injections or regenerative injections. But yeah, this makes it very convenient because you can practice anywhere.
Great, yeah. It does, and you could be on a beach and treating a patient, right?
Right.
or on your ranch.
And go ahead. The other thing, I said we're using Zoom. We're really not using Zoom, and for some of the other clinics, our phone system is internet, and it's with a company called RingCentral. And their software for virtual visits is identical to Zoom. It's the same thing. It just has it's like a generic form. And the nice thing is RingCentral is giving it away free to everybody who's in healthcare or education right now for the next 3 to 4 months. So if somebody does not have access to Zoom, that's another free way to get it. And it's just ringcentral.com, and it's identical to Zoom.
Well, that's a great tip. And I was actually going to ask you, did you have to invest in, what new technology did you have to invest into in order to convert to a virtual practice?
And, I'm working with a consultant in North Carolina for marketing, and he uses RingCentral. We've been having these virtual meetings now for the last couple of months, and our electronic records, when all this stuff came up, says we will give away our telemedicine program for free to all the docs for 3 months, but you have to get an account with Zoom and pay for that account. And I asked Matt, the consultant, I says, what's the difference between what you're doing and Zoom? He says, it's the same software. And so I thought, well, we already have it for free, and that's being given away free. So yeah, there is no cost to it. And that's really nice, because it's an extra cost to almost everything we do. Nice.
How about we move to patient response? Did you see any resistance to moving to a virtual model? And have you been getting any feedback from patients on how they feel about virtual visits?
Nobody's been upset about it. And I really think they're all looking at it as kind of an adventure. And I think a lot of them are very grateful that we're doing it right now. And in the beginning, the first week, we kind of gave them the option saying, we can do a virtual visit, or you can come into the clinic and see us, because we're here. And really, none of our functional medicine people took us up on that offer. They said, no, we'll just stay at home and do it over the internet. So they have really embraced it, and it's been good. Yeah.
Yeah, that's great news. Yeah. Is there any other tips or pointers, maybe in the transition process, that you have for your fellow doctors about transitioning to a virtual practice?
I do think you need a little bit of equipment. And luckily, I was doing some webinars about 5 or 6 years ago, and ended up getting a good microphone and a good camera that's better than the computer, and a good ring light so that you have light in your face. And I understand right now, with all the stuff going on, all 3 of those things are kind of hard to find on Amazon. But I would suggest that you get it, and it's only probably a $150 total investment, but it does make your pictures look a lot better. You show up better on screen. Now, the patients at home, they don't have any of that, so a lot of times they're kind of sitting in the dark and you can't see their face very well, and their microphones don't work too good. But that would be a big tip. It's just, if you're going to do this, invest. It's not much, just $150 for a microphone and a camera. And my microphone is right here, called a Yeti, and my light. How do I get there?
Yeah, it's like a ring light.
Well, there's a ring light, and I just have it up on a tripod in front of me. So, and I end up turning off the lights in the room most of the time because it just looks better. And yeah, that's my only tip. And really, I'd look at Zoom or the RingCentral.
Do you feel like, in terms of the support that Allison is giving your patients, has that changed recently because of changing to virtual, but maybe some other things that are coming up for patients right now? Do you feel like she's maybe talking to them more about stress management or self-care? Can you talk a little bit about that?
Really, both of us are doing a lot with stress management and self-care, and doing a lot trying to teach people how to shop at the grocery store. My wife used to manage a winery here in Billings up until all this hit, and it closed that thing down. And so now she's working at a grocery store. And we talk about this every night, all the junk food people are buying in bulk. And what we've done recently, the last couple of weeks, is try to come up with a functional medicine program to cope with the COVID. And our typical programs for 3 months are around $4,000 to $5,000, and people are having trouble with that right now. So our new program that we're working on at this moment is a 2-month program where we have group visits at night with telemedicine every other week, and spending a lot of time on teaching people how to shop right, how to cook right. I'm going to have some cooking classes online for them, and put them on a handful of supplements, not a lot, just a few, to really help with gut health, to repair leaky gut. with the idea if we can improve the gut health and teach people how to eat good food and not all this crap that they're buying, their immune system's going to be a lot stronger. And some of our people who have gone through our bigger programs the last couple of weeks have said, can we postpone this and start it up after the pandemic is over with? And I said, I'll stop everything, put it on hold, but I'll tell you 2 reasons not to do that. One, in our wellness programs, we start off with elimination diet for basically 6 weeks. And then we go through a detox program and then start reintroducing foods back. And I said, one, when all this stuff is over, it's going to be like the first day of summer in high school. You're going to be out partying and going to restaurants and eating everywhere. And, right now with this pandemic, you can't eat in a restaurant. You can only really eat at home, and it's a lot easier to control what you're eating. So you need to do it now because it's going to be hard come this summertime to do it. And 2, 80% of the immune system's in the gut. So let's get your gut good and healthy right now. So it does cut down your risk of bad complications from this virus if you get sick. So I'm telling people, there's 2 good reasons to go to functional medicine right now. And don't postpone it. Let the COVID virus be your reason to get healthy right now. And they're liking that idea, and they're all buying into it because it makes sense.
Yeah, those are great points. So we have, Stacy is asking that she wants to know how to join up with a coach. So I'm going to put that information in the box soon. And then they want to know how you pay the coach. So would you talk a little bit about your model, Dr. Hall?
Yeah. I went through, I guess, your organization in the very beginning. I called up and asked for said I was wanting to work with a coach. I've never worked with one, and I got about 7 or 8 names of people to call, and called them all and fell in love with one of them. And we worked together for a year, and then she moved off, and she says, I have another friend here in North Carolina that we trained together. I think you'd like her. And so I just said, yeah, send Allison to me. So that's how I kind of stumbled into it. And really what happened was in my clinic, I had a gal who kind of was our office manager, and she wanted to be more active in patient care. So I enrolled her into a different coaching program than the IFM program. And I think that started in January, and she was supposed to be finished in July. And so end of July, we moved into a bigger office so she could have her own private room for coaching and having people come see her. Well, about 2 weeks before that, after we signed a lease for the new building, she says, I kind of messed up on my coaching course and I didn't finish it. And it'll be another year before I get through it again. And I just, I'd made all these plans and got a bigger office for her. And so at the last minute, I said, we got to have a health coach. So I tried interviewing locally, and nobody was really trained on the IFM approach. So that's when we went to somebody distant-wise. And I don't regret it. We've not had any trouble with people saying, she's far away, you're close here. It's very easy. And the way we get paid, or she gets paid, is, again, our wellness programs are paid up front. And we've contracted a fee with Allison and I, and we limit it to 3 months every 2 weeks. And so she charges me a flat fee in the very beginning for those 3 months. We have had a few patients. We've had a lot of patients who at the end of the 3 months says, I'm really upset losing Allison. I'm going to be stuck with you now, and I don't like that. And I said, well, you can contract with Allison and keep the thing going. I have no issue with that. And we have had several people do that with her. And but again, most people after 3 months working with me and her, they really don't need us very much after that period. And I tell them that, we want to get you healthy, we want to get your hormones working good, your gut working good, we want to get you feeling good, but at the same time, we want to give you the information up here in your head, what to do to stay healthy the rest of your life. But I don't want it just there. I want it down here kind of in your soul, so you don't have to think about it. It's just automatic. And I said, with me and Allison coming at you so frequently, that's what moves it from here down to here, because you have 2 people harping at you every couple of weeks, and that's working very good. So then people ask, or you might ask, well, what do we do with people who drop out of the program? And we do have folks every so often, after a month, they say, like this is not for me. And what Allison does is she gives me back what the folks that have not used gives me a rebate back or refund back. So that's the way we work it. She bills me once a month for all the new clients coming in, and I pay it, and then we go from there.
Okay, so she independently contracts with you.
Independent contract.
Yeah, for that, and then she, if patients want to continue, they'll independently contract with her.
Exactly.
Yeah, great. Yeah, so Dr. Hall did, both of his health coaches were from FMCA. I just put the provider support line. You can call or text there if you want to find out more information. But FMCA does support providers in a number of ways. We have a job board, which is where Dr. Hall posted for positions. This is a free service. We have a support line where you can call or text to help with finding the right coach. You can learn about different models of coach-provider collaborations, both in the US and in our international communities. And right now, hundreds of our graduates have offered free coaching services to help people in need. So if you want to give working with a coach a try, or you'd like to pass on that information to patients, I'm going to put a flyer in the chat box now that you can use, and I'm also going to put my contact information in the box as well. But please let us know, everybody who's on the call, if you have any specific questions for Dr. Hall. I know Wafa is here. Hi, Wafa.
Hello. Can I ask Dr. Hall something?
Mm-hmm. Absolutely. Go ahead.
Yeah, I just moved to the internet with my phone. That's why I signed in twice. So, Dr. Hall, thank you very much for your input. This is amazing to see how you work and like the circulation in your clinic. I'm struggling getting a health coach but I'm starting to recruit ones from FMCA because they know exactly like the questionnaires and the elimination diets that we use and how our functional medicine mind think like. So the problem with the virtual meeting, which came just on time because I just had my baby, so I can't go to the clinic, and I've been telling my patients, well, I'm moving my practice to be online because I can't go to the clinic. So the COVID came just on time, so now nobody can complain about the virtual meeting.
Nice.
Yes. However, I do miss the when the patient comes into your office and he walks from the door to the chair in front of you and you can just diagnose what he has. I really miss this and the physical examination and looking into his mouth and his teeth and the gingiva and looking into his. So I just tell them, show me your fingernails so I can see the ridges and everything. So it's a little bit hard. How can you overcome those things from your experience, of course?
Yeah, I don't know. I'm really missing shaking hands and giving people a hug that are doing good. Both Rachel and I are really missing that here. And the physical exam part really has suffered with this. I don't have a good answer for that.
So do you see them, if there weren't any COVID, do you see them like maybe once every 3 months, maybe?
Again, we've mostly gone to a 3-month program, and really that 3-month program, minimum, I tell them it's every 3 weeks with me. If they want to come in before this for acupuncture or laser, we can do that weekly, and every 2 weeks with Allison. Then what we have after that 3-month program, we're calling it a VIP program. And up until the summer, everybody went on a 6-month program. And again, it was every 3 weeks with me for 6 months. And that was running around $5,000–6,000 to do that. And we had a lot of people sign up on it. But once we went to the 3-month program, that's about half that price. More people were joining up with us. And after that, we had the VIP program for basically $1,000. They get unlimited visits for a year. And in our clinic, if I don't accept anybody off the street, if you call me up and say, I got a sore throat, can I see you? I said, no. The only people I will see who have gone through our wellness programs, because I want those people trained, that they know what to do. And it's kind of selfish. That way I don't get bothered a lot.
Excellent.
So we're having people sign that VIP program, but nobody's coming in monthly or even weekly. It's like 3 or 4 times in a year. So I like that approach. I forget where I was going with that.
It's cost effective, yes, and it saves your time and their time as well.
Exactly.
Excellent.
Yeah. You know, and we tell them
Thank you very much.
our dinner seminars, we spend a lot of time talking about health insurance, how it really has messed up healthcare, and how it gets in the way of getting people well. And again, I stress that when you prepay this thing, it's like that all-inclusive trip to Hawaii. Without the all-inclusive trip, you go out there and lay on the beach, and the guy comes up and says, "You want to go scuba diving today?" And you say, "Well, how much is that?" They say, "Well, it's this much." And he says, "No, I think I'll just sit here." And then they say, "Well, you want to eat in a good restaurant or get a hamburger tonight?" Well, how much is a good restaurant? I don't know. I think I'll just have a hamburger. Of course, what we've done is taken most of the costs, and I tell people, you're going to have to invest in this program. But the reason we get good results is, one, you invest in it, so you're going to do what we tell you to do. And two, I got to get you better, because if I don't get you better, then you're going to tell everybody out there that our program doesn't work, and I don't get new people that way. So it pushes both of us to, I think, to do what's being said and to give good service.
Excellent, amazing. Thank you very much. I hope I can find my way, because of course we have a lot of restrictions in Egypt. I'm actually in Egypt. I'm basically the only functional medicine certified functional medicine doctor in the Middle East. So
Wow.
and we have a lot of so I have a lot of people coming like with a sore throat. We've heard about functional medicine. Can you take us? No, I can't. You know? Do you know anything about functional medicine? So I thought, sending them questionnaires, like testing their knowledge. And I'm really thinking of doing like a basic education about them. So you take the basic education. If you are well and good with that, then you can come and see me. But like you said, without their basic knowledge about wellness, they will be just wasting our time.
Yeah, exactly. And and it's
Thank
so
you
much
very
fun to have a relationship with somebody who's working to get well rather than asking for a pill.
Yeah, and that's the importance, I think, of having a health coach, because he can test these things for you as well.
Yeah, exactly. Well, that's
Thank
got to
you
be
very much.
lonely being the only one there.
Well, I have you. I see you. I
Good.
attend all the webinars, and we have a lot of like forums, functional medicine forums, that they're amazing throughout the world. So that's fantastic. But hopefully, I'm pushing some more doctors to join. I hope so.
Good. Yeah, we've both got to push hard.
Yeah, well,
thank you very much.
Yeah, thank you for both of your points. You know, there is healing in community, and sometimes when you're in person with community, that makes a big difference. But there is also, you know, if you just need to go over lab reports, there could be a cost saving measure there by including these virtual services. And, you know, just to kind of both of your points, that Health Coach does help you create a healing community and to check in and facilitate a lot of that collaboration. So thank you both for contributing there. And I know some people were saying they couldn't see the links. If you still can't see the links, please go ahead and send me your email in the chat box, and I will make sure that you get those directly after the call. Yeah. Well, if nobody else has any questions, Sandy, if you want to, I don't know if you have anything else.
Yes, this has been a great conversation and lots of good tips. And I want to acknowledge Dr. Hall. Thank you for taking the time out of your busy day to be here. And I just wanted to make another point that our coaches are trained virtually. And for 12 months, they are getting on Zoom. They're doing breakout rooms. They have all of their live training sessions that way. And so one of the things we're also hearing from practitioners is when a coach comes on, is working virtually, then they're really helping that practice because they're already experienced Zoom virtual users.
Nice. Yeah, thanks for having me on. This has been fun. And thanks for the work you do, and thanks for Allison.
Absolutely. Yeah, she's great.
People in Montana, thank you.
Yeah. Wonderful. All right. Okay, Stacy, I'm glad you can see the links. I'll keep them up for a minute, but anyone who wants to jump off, have a great day.
Thank you.
And reach out if you need anything. If you need any support, please reach out.
Bye, everybody.
Bye-bye.
Thanks,
Thank
Andy.
you.
Bye, Wafa.